I'm really, really passionate about helping young people through what has been an incredibly difficult time. As you've said there, they've shown such resilience really in this time, but we need to be there to support them, to provide the structures in place so that when children go back to school in the coming months and years, that we really help them get through this time, that we build resilience, and we give them the toolkit that they need to be able to go on to becoming adults that are able to do what they want in life, but happy and feeling that they've been looked after. Everyone has mental health, and it isn't a bad word, isn't a bad thing. When you talk about physical health, think about sports, cardiovascular fitness, all these things. Mental health can be about resilience, about building yourself, about feeling positive, about mindfulness. It can be a really good thing, and that's what I want to do. We're bringing positivity.
But the big flip that I like about what you're saying is, and the big switch is from thinking about mental health as a positive thing that we can all improve. And so it's not just that there's a category of people who suffer from what we call mental health problems, but there's that everybody actually can benefit from taking their mental health seriously, just as we take our physical health.
When things go wrong, as they do in life, we can't put cotton wool around people, we can't prevent bad things happening in the world, but if we can give people that toolkit so that when things go wrong, they know how to look after themselves, they know who to go to. I lost my brother this summer. He was 19, about to go to medical school, and we were incredibly proud of him as a family. And sadly, he took his own life. And I think the pressures of this pandemic, played a big part.
I'm so sorry.
Thank you.
About that, Alex. And I can only imagine what it must be like to lose a younger brother like that. And it's fantastic that. You want to use all your experience and all that you've been through to help other people, and maybe to reach out to people who find themselves feeling that sense of whatever it is that drives people to despair, and showing that there is another way. And I think that there are so many different categories, and some of it is going to be about therapy and help, and I believe strongly that therapy and help can make a huge difference to people, and that we're putting a lot of investment into mental health care services. But sometimes I think people can be helped by something as simple as listening to somebody such as yourself talking about it, reaching out to them.
Breaking down that stigma, isn't it? And the feeling that I want to live in a world where people feel like they can speak about their mental health in the same way as their physical health. The number of times I work in A&E, and I've seen people come in who have really struggled with mental health, and I'm the first person they talk to, and I think that's really sad. It's almost a failure in some ways as society that person couldn't speak to a loved one, a friend or a GP before they ended up in that position. So I think the passion and the feeling for this country is we want to make positive change, we want to move forward. We have made some steps, clearly there is some positivity there with some of the change that are being made, but we've got further to go, and of course this pandemic means we've got so much work to do, and I'm hungry and I really want to help, and I feel very honoured to do this.
Well,
I hope I can help.
It's fantastic that you're doing it. It's a massively important issue for our country. There are simple things that you can help to teach us all, and I'm very, very grateful.
Thank you. Let's make some change.
Thank you.